All right, so hello everyone. I can see us on our live feed, so that means we're good to go. Thank you so much for joining us today. We have some representatives from Baby Blues Connection to talk to us about what's going on with postpartum right now during the current pandemic. And we're so lucky to have Trinity Toft. She's a psychotherapist in practice with Rose City Family Wellness. And then also Dr. Noelle King in practice at Femel, am I saying that one correctly? Femel Integrative Medicine. So thank you both so much for being here. If you could just give us like a real quick overview of Baby Blues Connection and then a little bit more about yourselves, and then we'll dive right in to postpartum stuff for right now.
Sounds great. Thank you so much for having us. So Baby Blues Connection is a organization, nonprofit in Portland that was started by Wendy Davis, who is the founder of Postpartum Support International. And it was started with the idea that moms need moms and need support for postpartum depression, anxiety. So Baby Blues created free support groups that happen usually every day of the week. They are now all virtual. And they also have groups for dads specifically. And they are run by volunteers who all get a certain amount of training about perinatal mood disorders and ways in which to support moms and partners and families. So that's the overview about Baby Blues Collective, and which Dr. King and I are both board members of.
Awesome. Can you tell us a little bit more about you and what you do, how you integrate your background with Baby Blues Connection?
Sure. So I'm a licensed clinical social worker and therapist. Currently, I have a practice that's called the Mother Birth that was inspired when I had my own child to really focus on that transition into motherhood and focusing on women's mental health and perinatal mood disorders. My practice is concierge therapy, which means I do go in home. And I also have an office with Rose City Family Wellness, which all the practitioners there focus on the postpartum experience and families and supporting families. What else about me? I also work at a Legacy Hospital right now as a social worker in family birth and in the emergency department. So I'm wearing a lot of hats right now. And as we all are now homeschooling teachers and all of the things. And so I found Baby Blues Connection and was really excited to be a part of the work that they do to support families around Portland.
That's great. How about you, Dr. King?
So I am a naturopathic physician, and I have had a pretty long history with women's health and postpartum health. I started studying midwifery in 2005, and I spent a good chunk of time on the farm with Ina May Gaskin. And I did that for a while, and then I graduated with my doctorate and a natural childbirth certificate from the National University of Natural Medicine. And after that, I had an integrative OBGYN focused residency. So currently my practice is focused on integrative gynecology and primary care, but with my personal specialty being in fertility, pregnancy, safe primary care, and postpartum health. I'm certified in perinatal mental health by Postpartum International, and I've been, and so is Trinity. Yeah, we're both board members for the Baby Blues Connection, and I'm also trauma informed. And my practice has been testing COVID for the past month. So I have been doing that dance as well. My my office is usually, just you come into the office and have a visit, and I normally only offer home visits for postpartum people. But now I'm just kind of like Dr. Quinn Medicine Woman, where sometimes I go to people's houses if they don't want to leave the house and it's safe. So yeah, all of the things. But we are both advocates of what's going on in the situation and really trying to help, because this population in particular is, has its own vulnerability to begin with. So it's a really interesting time for them to be balancing all of this excessive newness. It's a lot to handle at once, for sure.
Definitely. Well, I am going to say that I'm super jealous that you have been on the farm. I think that's the coolest thing. So let's get into the crux of the conversation being about postpartum right now. And I will let you guys take the lead. And then once we're done with that, I'll do a few question and answer, or a few questions that we have.
Sure. So postpartum right now. I think what's the benefits of being postpartum right now is, and when I say postpartum, I usually mean 0 to 5 years after having a child. I think the context is usually associating it with the first few months after having a child. So, if you are immediate postpartum, your situation is obviously different than if you have a toddler. But immediate postpartum, the good part is you are already likely going to be in an isolation anyways, which is, kind of the way things go, where you're nesting and you're trying to navigate your new existence and healing, as well as taking care of this child. But unfortunately, the resources that we seek out for postpartum are now limited. And, we already have this issue with the lack of village that's happened in our society, where, it takes a village to have a child, but it's dwindled down to just you and your partner, or just you. So there is, this different kind of, this different situation that you're dealing with already, and not being able to have your lactation consultant come to your house, not being able to necessarily go to your doctor at the drop of a hat, maybe limited pediatric visits, and also human contact, having somebody come over and show you how to bathe your new slippery baby, because that's like, how do you train for that to begin with unless you have had one? So there's a lot going on there, and it's multifactorial. And the things that we want to advocate for is for women in this situation to still understand that they have a voice and they have needs that can be met. So that's one of the motivations that Trinity and I have for being here. And also, we both teach a postpartum reality class that tries to express those needs and awareness, because we don't really have that much awareness around postpartum. It's just have the baby and good luck. So yeah, it's a different situation for sure.
I think the thing that I want to acknowledge the most for women who are currently pregnant or recently postpartum is grief, right? This is not what you all wanted this situation to look like. So there is a lot of grief. That itself can make you more vulnerable for postpartum depression, postpartum anxiety, postpartum OCD. Psychosis is limited to a lot of people. So I won't even mention that. If you have questions, you can reach out to me. And so I think that is a big thing, to be able to hold grief and also hold space, that knowing that this is going to pass. And just like the postpartum period, this experience that we're having right now, I'm not saying when, but it will pass. And not that it will get back to how it was, but it's going to look different. And that our expectations, we're going to have them, but how can we be in a place of reality, right? When we're focused on a lot of, I wish it was like this, or if only, or with my other kid, it was like this, right? We're getting into that loop of anxiety and the sort of what ifs and the shoulds and the coulds and all of those things. So as much as people can focus on that this is the reality, how can we be in this space holding that grief and making space for yourself, which we'll talk about in some of the questions that sounds like that people have asked, because this time looks really different than a lot of people thought it was going to, especially for a population that, you know, like Dr. King said, is already vulnerable.
That makes a lot of sense. And I think that's something we're coming into a lot with many of these talks around what's going on, is there's a sense of grief about the situation for everyone, because nothing is how anybody planned on it being. So did you guys want to touch on anything else, or do you want me to hop straight into the questions? Because I've got a couple ready here.
You can just hop straight into them and then we can.
Okay, great. So the first one is from the people that want to be the supporter of the postpartum family or person. It's that we were planning on, you know, going to that friend's house, maybe watching their older kids, potentially doing chores, like even just watching the baby while mom gets to take a nap or something. And since we can't do that for them now, at least in the near term, what can we do to help them in that regard?
So, you know, there's a handful of things you can do for sure. We are converting into this really weird simulated, like way of living through Zoom. It's very strange, but you know, if this was 20 years ago, we wouldn't have this. So this is a blessing. I know some doulas that are being present at births through Zoom or through FaceTime. So that's occurring. For a person who, you know, planned on being the support person for somebody postpartum, whether it be a postpartum doula or family member, the things that I like to counsel my patients on is when you are pregnant, and maybe they're past this point, but if they are pregnant, I like to have them write on Post-it notes all the things they do during the day and what they would probably like help with when someone comes over, right? Because it's really hard for a woman to ask, like, you know, I don't want you to hold my, nobody really wants you to hold the baby. They want you to like do their laundry or like something like that. So, but it's difficult for them to ask because then they feel like they're the hostess and they want to be gracious. But if they have all of that stuff spelled out, it's really easy for the support person to come in and be like, oh, you know what? I can do that. I can do that. So, you know, creating that list when you are pregnant is valuable. And instead of having them in Post-it notes, maybe writing them out and sending them to the people that you know want to offer support. Maybe still having them up there for your partner who might need some reminders, even though he or she might think that they're sleep deprived. They're not as sleep deprived as you. So, you know, and then that person can show up the way they want to, or in the way that is safe, right? So whether that be setting up a meal train, super important. Maybe they're on diaper duty. Maybe they are the ones who are going out and buying the wipes, going out and buying the diapers. Maybe they're taking your trash out. Maybe they're doing your yard work, things like that. And then check-ins. Check-ins are really, really important. And a lot of postpartum women won't, you know, pick up the phone because they're tired, pick up the phone. So just blow up their spot and like keep calling, keep Zooming, and, you know, just be with them. You know, I was on a talk last week with a postpartum doula and a doula, and sometimes they're just on the other line and they're just there and they're just present and they're doing their thing and the other person's doing their thing, and every once in a while they'll chime in, and maybe just the active presence of somebody being in your space would be really helpful. Also, you know, checking in and maybe in your mind's eye, looking out for things that might be red flags for somebody. They're usually like this, but I see her doing this. And when I see her on Zoom, she looks sick, or she looks like she's not eating. And, acting as that friend or family member role, just looking out for them with things that they may not even be considering because they're in their own zone.
There's a lot of things that I'm really big on people being a witness for: marriages, births, the kind of those big things that we talk about. It's my job to be a witness in my profession. And so even being able to be the person who's just holding that space for someone else can be what they need. And yes, it does look different right now, but we can still be, in a text thread with other women who maybe are as far along as you or recently postpartum. I remember when I was in my, waking up 5 million times in the night phase with my kiddo, and I had 2 other women that I would just be like, up again. And man, they were up again too. And it was so comforting to have those people knowing, even if we didn't see each other for ages, that they were my witnesses, and if you have the means to, you can send groceries to someone, you can send flowers to someone, you can send cards to them. I've done a lot of, everyone's cleaning their houses right now, and there's a bunch of stuff you don't want. So if it sounds like this friend may have an older kiddo, go and drop off toys that your kid isn't using, puzzles, have, make a card for them, just simple things that just lets someone know that you're thinking of them, even if you can't be there for them in the way that you had anticipated. So there's a lot of ways that we can still show up for people, even if we're not physically showing up for them.
That makes sense. So now that I know how I can help people, I have some questions from women that are in this right now, and one of them feels a little bit loaded, but like, I don't know, we'll try and take it apart. She says, I'm worried that being at home all the time will cause or increase my PPD or PPA. So what can I do is the question.
So the weird thing is, and I've heard a lot of people say this who are moms with older kids, is that quarantine kind of feels like the 4th trimester, which is that 1 to 3 month period anyway. And then we've just added this deadly virus on top. So no big deal. But it does feel like that time where you're just kind of quarantined and there's not a lot of people coming over. And maybe some of the people you did want to come over, whether it's family, close friends, things like that. But again, kind of going back to, the other question we just talked about, finding ways in which to keep connection happening. The biggest anti-isolator is connection. So maybe that means you're checking out some baby blues connection support groups, even if you're not in that space already. This is about creating that team for yourself, creating, most people are virtual right now. Like, you're probably not going to be able to get a massage and like acupuncture with needles and things like that, if those are things that you were hoping to use, but you can still get your primary care, your therapist, who else is out there? An herbalist can send you something, so there are ways in which, and even, there are people who are massage therapists and people out there that are like, here are some ways that you can, use some pressure points on yourself and things like that. So finding ways in which you can still connect with people and doing things that make you feel normal, whatever that is for you. Like yesterday, I wore red lipstick, even though I had a mask on underneath, but that made me feel good. And so even if it's those tiny things that you're like, okay, this is like my own self-preservation right now. We have to sort of suspend this idea of normal and normalcy. And what are the things that I can do to take care of myself that may look different than how they did before?
Yeah, and I think a huge lesson with this is motherhood is never exactly as planned, right? Like just like your birth, like you had your birth plan, you were going to have your baby under the tree being delivered by owls, and like, you know, all the deer were going to come out as your doula. And then you ended up with a C-section, you know, and it's like, okay, so that's just, parenthood is about being in the moment. Parenthood is about rolling with the punches and trying to navigate things as they come. So there is a little aspect of planning that's helpful, but there's also an aspect of surrender that's really going to help you get through everything. So like Trinity was saying, like setting up your support team that you would have normally had. And you know, maybe you didn't even think about this because you were more focused on buying a stroller, which is normal, but you know, having a therapist, having you know, maybe like your postpartum doula, or like a tummy time class that your kid is going to be, that you go to once a week with your baby, that's now offered virtually. You keep those things, so you keep what you would normally have anyways, but now there's virtual options. And of course there is still in-person options for things that are urgent, and keep that in mind that, you know, you still have urgencies, so it's okay to ask for help when there's urgencies. But all of those things can still be preserved.
That's good to keep in mind. So we'll go to the next question, which is different. It is, since my baby can't socialize with others, I'm worried that they won't develop the necessary social skills for their age group, or will have increased separation anxiety once things go back to normal. Can you guys speak to either of those things?
Yeah,
for sure. So your newborn they can't see very well. You know, they're not like, they can't even see your face. They can smell you, right? They can smell you from across the room. That's why usually immediate postpartum women's body odor is strong, to say the least, but that's so your infant can smell you from across the room. So knowing that you're still there. Hearing people's voices is what is really important to them when they're small. I mean, they think the chair, you know, or like your hair tie is like the most psychedelic thing they've ever seen. So they're really kind of focused on like the world around them. But, you know, Zooming and having phone calls and just hearing people's voices is what they're going to really connect with. Babies don't really socialize so much with other babies. I mean, you'll notice like when you do play groups, or maybe you haven't noticed this yet because you're new postpartum, but when you do play groups when they're little, they just kind of like maybe look at each other, and it's really more about the moms hanging out, and they're like, oh, look, he looked her way once, and they're best friends, but really like they don't really care. So when they're older, you know, that things can start coming into play, but even up to age 3, kids are really like developmentally needing maybe an hour of socialization with other kids. So, you know, we as a culture put our kids into daycare and school and all that stuff a little early, but traditionally it's not like that. They're just kind of with their family. Even 20 years ago, people were just with their families. So I don't think it's going to cause any type of like over attachment. And, you know, in the contrary, because attachment parenting is all about having the kid on you to then be so confident that they are going to be very independent. So the attachment parenting theory is not having them be attached to you forever. It's really about building confidence. So I don't think that is going to be the case with most children. And then, you know, when kids are a little older and they do have established friendships, you can Zoom and like have them oddly play with each other through the screen, but that can be really helpful and nice.
Yeah, really the only thing I have to add to that is, babies don't even know that they're separate from you until they're like 6 or 7 months old. And, that's when separation anxiety usually starts to kick in. Um, but you probably don't need to worry about that now because we're all just together. And people are doing things on FaceTime, it depends on, I think a lot of screen time rules have gone out the window right now, which, just do your best right now. And, so Zooming with kids' friends and, reading stories over FaceTime, they want to see their buddies and then they forget about it a couple minutes later. So
Yeah.
Good. That's good to keep in mind. The kids will be okay.
the kids will be okay.
They'll be fine.
The amazing thing about them is that they are flexible and resilient and they're going to be fine. And if they're not, there's therapy.
Oh, well, good. So going to the next question, it's not so much a question as it's just kind of like somebody was asking me, like, they know that mental health and sleep have a pretty strong correlation. And if you're not getting enough sleep because of being recently postpartum with like a newborn or in that fourth trimester or beyond, because not all of our kids sleep well even after that, what do you do? How do you deal with that portion?
Well, I mean, luckily you don't have to go anywhere or operate any heavy machinery right now. So that's a plus. But it's so normal for a baby to wake up every 1 to 3 hours in the first few months of life because they're hungry or because they want a snuggle or something. It's usually because they're hungry, but so you need a minimum. It's sleep cycles go in 3-hour chunks, right? So at the 3-hour mark, if you got 3 hours straight, then you're actually really good. You can function for the day, even though maybe someone who's pregnant, who's listening to me right now is like, no way, I need my sleep, but you'll get there. You'll understand. Anything less than that, you are operating as a drunk person, like brain-wise and cognitive function-wise. But all of that is going to shift once the baby's stomach gets larger and is able to contain more milk. That will satiate the child for a longer period of time. And then also their hormonal shifts happen around 3 months anyways. So if you wanted to do any type of sleep training or do any type of like monitor with your food, with their milk intake, it's possible around then. And they just start sleeping a little bit more around that time. Some kids will sleep at least 6 hours through the night. I mean, my 2.5-year-old doesn't, but that is a normal part of postpartum for sure. And now you don't really have to go anywhere, so you can sleep with the baby, which some people do and some people don't sleep when the baby sleeps. But that is hard. That can be really hard to navigate, and it also can be a preemptive thing to, kick you into postpartum depression or hormone dysregulation, thyroid stuff. But it's pretty par for the course for the first couple of months.
Yeah, I'll say to people say sleep when the baby sleeps, and the truth is you probably won't ever sleep again, and that's fine, but you need to at least try. And so creating kind of like the best case scenario, if that means you don't sleep with your partner right now, or you do sleep with your baby, or you don't sleep with your baby, or you're sleeping in a different room, or whatever it looks like, about being flexible with the cycle of baby sleep versus like it's daytime, it's nighttime, like baby doesn't care, right? Managing caffeine and alcohol intake is going to be a big thing. I know that we want to start like pounding coffee, and there's this whole like mommy loves coffee like whole like lifestyle meme, I don't know. And we, if you drink it, you love it. that's fine, but maybe stop at a certain time of the day so you're able to get to sleep at night. Same thing with alcohol. Stop at a certain time of day. I'm just kidding. Stop at a certain time of night.
No, don't drink if you're breastfeeding.
Yeah, that too.
So speaking of breastfeeding, I think that brings up a good point. What if a postpartum mom is having trouble with that and establishing it? What does that look like right now as far as getting help, as far as being able to continue doing that? What does that look like?
What does that look like? So if you are regardless of where you're having your baby, if it's in the hospital or if it's at home or a birth center, the baby is being evaluated with after birth, right? And one of the main difficulties with breastfeeding is a tongue tie. So baby or a lip tie. So that's when the frenulum, the little skin from the top of your lips, your gum, and the bottom of your tongue to the bottom of your mouth is too thick. And that is usually being evaluated by either your midwife or a lactation consultant in the hospital within the first 24 hours. So, usually it takes a little bit to get into the flow of breastfeeding, and a lot of lactation consultants are doing Zoom visits. And if your child is a candidate for a frenectomy, which is when they clip that is also, depending upon the case, is still being performed. But again, only urgent things are urgent medical situations are being conducted right now. But depending upon the severity, that can be an urgent thing. So that can be addressed. Or, then certain midwives or physicians that do home visits also that have lactation support experience can also come to your home if it's an emergency. If your baby is failure to thrive, that's an emergency. If you're, there's definitely support around that. And that is it's a really important thing to address, and not just kind of like throw under the rug being like, oh, it's COVID, no one's going to come here, no one's going to help. Like, if you want to establish breastfeeding, you should be able to do that for sure.
I've unmuted myself. Sorry about that.
I was like, she'll figure it out.
Yeah, eventually I do. So we're about wrapping up on time. Is there anything in particular around postpartum that you think we should touch on before we sign off today?
I think that there's a few things as far as if you're pregnant, there are different risks with COVID and what that looks like for your birth. Women who are pregnant are more prone to getting lung infections. And the way that COVID works is it's not on these things called the ACE receptors that are on your lungs, your heart, and throughout your GI tract. And they cause an anti-inflammatory response to happen. So that's where the virus is binding. So then the body can't defend itself as it should, or as it normally would. So because of all the relaxin that's going on through the body, women's lungs anyways are looser. So that's why respiratory infections are more likely. But ACOG is not saying that pregnant women are in a higher risk category, but they're not saying that it's more severe per se for a pregnant person. There's a few instances in China where the pregnant women, it was severe, but our testing is limited, so we don't know how many people actually have had this disease. We don't know how many people have come in contact with this virus. So going on what's being said right now is not super valid, because it could be much worse. It could be better, it's not going to be better, but it could be much worse. So that's something to consider. It doesn't seem as though the virus passes vaginally or through urine. It does spread fecally. So if you are having a vaginal birth, poop always happens. I'm sorry if you're pregnant and you don't want to admit that, but you will poop. And So I think that the nurses are being they were always careful, but now they're being really careful about, cleaning up the feces and making sure there's no cross-contamination there. There has been conflicting studies about it crossing the placental barrier, but it's not being shown to be in any amniotic fluid, which is promising, and then does not pass through the breast milk as of right now. So if you are COVID-19 positive and you are breastfeeding, you are going to be giving your baby antibodies, because that's what breast milk is, right? It's just like immunity. And you will pass it to the baby if you are breathing on the baby, or if for some reason you pooped on the baby, or you're in the bathroom and you don't shut the toilet. You don't do this before you flush, because then poop goes fecal matter goes everywhere. So those are the kinds of things that a baby can be exposed to. But right now, if you are positive, you have to be masked up, and but it's not going to go through the breast milk, which is great news. So I guess I wanted to talk about that, and there's there's emerging antibody testing if you are concerned about your exposure. Is any test perfect? No. All of the tests are not perfect. Even the tests they've been doing for a long time, they're not perfect. But if you want to investigate your immunity and see what that looks like, you can definitely, there's an option now. So that's really promising and great.
I think the things that I'll say is that it's really important to find somebody in your life to be honest with right now. Whether it's your partner or your best friend or your mother or your sister or somebody, to let them know how you're really doing. Would it be great to have a therapist on call? Sure. If you can talk to somebody that you already have in your life, great. Support groups are available through Baby Blues. Therapists are doing virtual appointments. This experience is going to be harder for you than it would have been if we were not experiencing COVID right now. That's just the truth. So to be able to acknowledge that and know that there's somebody that you can talk to about this. The first thing that happens when you become a mother is this martyrdom of well, I guess, I sort of have to bear the burden of everything. And that isn't true. Just because COVID is happening right now doesn't mean that you don't get to be taken care of just the same way that you're taking care of your baby. You actually probably need more support. So being able to find some space in your house, some space outside where you can go be alone, even if it's for 5 minutes. Dr. King makes fun of me that I took a shower every day, but that was my moment, that I needed. I took a shower every day when my baby was born. I washed my hair, but that was my time that I needed for myself. So whatever it looks like for you, that time is even extra important right now. And finding whoever that person or people are going to be that are going to be your extra support, because you do need it right now.
A good reminder. I'm gonna try my best to support my postpartum friends as well, because I can imagine it's different, as everything is. Do you guys have a class coming up sometime soon, and is that online around postpartum?
Well, not yet. It's been a lot with both of our jobs and with Baby Blues Connection to try to figure out this world. So we will be definitely starting things up soon with our postpartum reality series, which is breaking things down in a very real and humorous way. So we should be doing that soon. It's not the same, but it's what is. Sure. Maybe it'll be cooler. I don't know. But yeah, we will let you know when that is back up and running.
That sounds great. Be sure to let everybody know. Is there a way people can get in contact with you two specifically if they need to?
Yeah, so we have a joint email of Real World Postpartum at pdx@gmail.com. So that's for our class. And I am at Female Integrative Medicine, and that's femaleintegrativemedicine.com, or my email is dr.ndkingnd@gmail. And that's how you can get a hold of me.
Perfect.
You can find me, my website is themotherbirth.com. You can find me on Instagram at themotherbirth, and you can find me at Rose City Family Wellness to book appointments online. Of course, all appointments are virtual right now. And if you, I am doing concierge home visits if people really need them, fully masked. And you can email me at hello@themotherbirth.com.
Perfect. And I will make sure to get information both in the comment section of this live, and then eventually as a full blog post too. But thank you both so much for joining me today. I think this is very, very helpful, and I really appreciate your time.
Thank you so much.
Thank you, Katie.